Hi guys, it's me, Professor D, and welcome back to my YouTube channel. On this video, I'm going to be covering anorexia. I'm going to be going over the risk factors, the clinical manifestations, important nursing diagnoses, and nursing interventions. So if you haven't done so already, I'm going to ask you to please support me and support this channel. Like this video, you're going to love it. Give it that thumbs up. Press the red notification button so you'll be notified every time a new video is released. And please don't forget to subscribe to my channel if you haven't done so already. Also, I'm now doing NCLEX NGN review sessions. You can book it on my website, nexusnursinginstitute.com. Also, if you want to check out an audio lesson, you can find that on my website as well, nexusnursinginstitute.com. Almost daily, you guys can find me covering a variety of nursing topics on my other social media platforms, such as TikTok, Instagram, and Facebook. So be sure to check that out. Okay, guys, let's get started. Anorexia nervosa. Okay, this is what we're covering. What eating disorder shows characteristics such as intense fear of weight gain, distorted body image, and restricting foods? Is it anorexia? Is it bulimia? Is it pica? Or I have no clue, Professor D. Everyone should get this correct. I'm not going to tell you the answer. How did 13 people still get this wrong when you saw the title of this, which is anorexia? So I want to go over the biggest difference that you guys will see between anorexia and bulimia. So look at these characteristics: intense fear of gaining weight, distorted body image, restricting foods. So the patient that has anorexia, they are more likely the ones who are just not going to eat, or they eat just a little bit of food. They have severe food restriction. They're the ones who are going to be severely overweight. Where bulimia, on the other hand, with bulimia, that patient usually tends to be at the normal weight that they should be, or just slightly below or slightly above, but they're right around the weight that they should be. And the patient with bulimia, what happens is, they'll eat, and then they'll purge. They'll go to the bathroom to have a bowel movement, or they'll vomit, but they have excessive eating and then purging. Where anorexia, they just won't eat at all. And pica, this is a condition, this right here, pica, this is a condition where the person will eat foods that have absolutely no nutritious value, such as dirt. Select all that apply. Which factors increases the risk for anorexia? Select all that apply. Genetic, neurobiological, psychological. I need to study this. What do you guys say? Select all that apply. What do you think are the factors that increases the risk for anorexia? Okay, let's talk about it. It is all three. So genetic factors, studies have shown those who have a genetic link, especially first degree relatives, there's like first or second degree relatives, we see they have an increased chance of being anorexic by 60%. Neurobiological, that's true as well. So what happens is, if there's an alteration in the patient's serotonin level, that can increase their risk, because with that alteration in serotonin level, it messes with their appetite, it messes with their impulse, it messes with their mood. Psychological, and this is true as well. Just think about it. You have a teenager that they haven't been to school for a week because they were sick, and then they come back to school and everybody's like, oh my gosh, you look so good, you look so skinny, you've lost weight. So they're getting positive reinforcement that even though they lost weight because they were sick, everyone's telling them how good they look because they lost weight. So that positive reinforcement, that is a psychological factor. So yes, all three factors are factors that could possibly increase the risk for anorexia. Select all that apply. What are some thoughts and behaviors associated with anorexia? terror of gaining weight, peculiar handling of food, pushing pieces of food around the plate, judging self-worth by weight, dental caries, tooth erosion, parotid swelling. What do you guys say? Okay. So we're talking about anorexia and the thoughts and behaviors. Terror of they are terrified of gaining weight. Absolutely. Peculiar handling of food, cutting foods into small bits, especially when they're like in a public setting and they're self-conscious about it. You know, they don't want anyone to notice, right? So what they'll do, they'll just play around with their food to kind of act like everyone else as if they're eating, but they're really not. Pushing pieces of food around the plate, same thing. So they'll cut the food into a whole bunch of smaller pieces so it could look like more, and then they'll mess around and just, you know, they'll just move it around in their plate, but they're really not eating it. Judging self-worth by weight. Yep. And let me explain this to you. So the patient who is anorexic, typically this is a problem with control. Okay. And what I'm about to say, don't come for me, guys. It's in the textbook. Read it yourself. I'm not making this up. But what studies have shown, your typical adolescent or young adult who is anorexic, they tend to have a background of a very demanding mother. Sometimes parents, but usually mother. So the mom, you know, expects her to be the captain of the cheerleading team, president of student council, and, you know, her life is already planned out for her, what's college she's going to attend, what her career is going to be. And so she feels like she has absolutely no control over her life whatsoever. But the one thing that she can control is her body, what goes into her body. So that gives her a sense of power, because in all other aspects of her life, she feels powerless. She feels like she has no power whatsoever. So this disorder really, guys, is an issue with control. And so if they can't control it, they feel like they're worthless. And so they feel like the more that they can control it goes into their mouth, and, you know, everyone around them is eating, but they stay skinny. They judge themselves. They're worth by that. Okay. Now look at the last two, which are wrong. Let me tell you why they're wrong. Dental caries and tooth erosion. Remember when I talked to you about bulimia, I told you a patient with bulimia, they tend to have excessive eating and then purging. Well, what happens is when they're purging, they're throwing up all that food that they ate, because what happens is they'll get anxious about whatever it is, and they'll eat. And then they feel guilty. They feel guilty that they ate all that food, and then they'll go to the bathroom and purge. And as they're throwing up, guess what? They're not only throwing up food that's in their stomach, they're also throwing up that hydrochloric acid. And as that hydrochloric acid is coming up, it's burning the esophagus and it's causing dental erosions, and it can cause teeth decay as well. And that's why you also have that parotid swelling. So these two down here, that goes for bulimia, not anorexia. Select all that apply. What are signs and symptoms of anorexia? Select all that apply. Low weight, I can't speak. Amenorrhea, lanugo, weight gain, constipation, and hyperkalemia. What are those signs and symptoms of anorexia? Select all that applies. Okay, let's talk about it. So low weight. Yeah, because they're not eating, right? That's the whole issue. So yes, low weight. Amenorrhea. So the low weight, because they're not consuming any, you know, calories. Amenorrhea, why? Because of the low weight, they're starving. And so what happens is their menstrual cycle will stop. And you tend to see that in adolescents and young adult women who are just very, very athletic. And if they're very, very small, they've lost a lot of weight, their menstrual cycle will stop. You'll see this with like a lot of female gymnasts, okay? Because y'all got to be real small to be a gymnast. Lanugo, those little fine hairs, yeah. Why do you think they developed that? Because of that starvation. They're starving themselves. Weight gain, false. We don't see weight gain in anorexia. We see weight gain typically in bulimia, and what they'll go up and down with their weight because they'll eat, and then they'll feel guilty and then they'll purge. Again, the patient with bulimia, they'll either be at their target weight gain or a little at their target weight or a little bit above or below, but the patient with anorexia will be severely below weight. Constipation, yeah, they're going to be constipated because remember, what are teaching you tell patients? What are things you tell patients to do not to be constipated? You tell them to drink lots of fluids. You tell them to eat lots of fiber. Well, guess what? And you tell them to move around. This patient with anorexia, they're not drinking. They're not putting anything into their body, or if they are, it's just a little bit. So they tend to be constipated. What about hyperkalemia? Nope. That patient with anorexia, think about it. They're not putting anything into their body. So those foods that have potassium, it's not going into their body. So we tend to see them what? Hypokalemic, not hyperkalemic. What should be a priority nursing diagnosis for anorexia? Altered nutrition, less than body weight, ineffective coping, chronic low self-esteem, or powerlessness. What would be a priority nursing diagnosis? What do you guys say? Very good. Most of you guys got it. Excuse me, got it right. Excuse me. Altered nutrition, less than body weights. Whenever you get a question asking you about priority, you have to think of Maslow's hierarchy of need. What is it that's going to keep my patient alive the longest or kill them the fastest? So it's going to have to do something with nutrition, with fluid and electrolytes, with rest, with vital signs, with hemodynamic status, those things that will keep your patient alive. So that's going to be your priority. Yes, ineffective coping is a nursing diagnosis, but it's not going to be a priority nursing diagnosis, but it is a nursing diagnosis because we know if the patient is anorexic, they're not coping well with that feeling of, having no control over their life. And so now they have this disorder. So they have ineffective coping. It's just not a priority. Yes, they have chronic low self-esteem because again, their life has been all planned out for them and they feel like they have no power. That's why they've turned to anorexia and they're really not eating. So they do have chronic low self-esteem and they're basing their low self-esteem on their weight. They're basing their self-esteem, I should say, on their weight. And of course, powerlessness. That is a diagnosis for anorexia. They do feel like they don't have any power in their life. But again, when you're asked about a priority nursing diagnosis, always go with physiological integrity. What's going to keep your patient alive or kill them the quickest? Select all that applies. What are appropriate nursing diagnoses for anorexia? Oh, I gave you guys the answers. Select all that apply. Oh, well, not all of them. So what do you think are appropriate nursing diagnoses? Decreased cardiac output, risk for injury, risk for imbalanced fluid volume, disturbed body image, ineffective coping, powerlessness. Okay. Yes on decreased cardiac output. Think about it. The heart can't put out what it hasn't gotten, right? This patient isn't putting anything into their body. So how are they going to push out fluids and blood and electrolytes when nothing has gone in? So they're going to have decreased cardiac output. Yep. Risk for injury. They are below the body weight. They're not eating nutritious meals. They're going to be weak, right? And they were going to have problems with electrolyte disturbances. Yes, they're increased risk for injury. Yep. Risk for imbalanced fluid volume. Absolutely. Do you think when we talk about imbalanced fluid volume, do you think it's going to be too much or too little? Too little. They're going to have fluid volume deficit. Disturbed body image. Absolutely. No matter how skinny they are, they feel like they can get skinnier. Ineffective coping. Yep. They can't cope with those feelings of powerlessness. So what they do is starve themselves. And of course, powerlessness. So all of these are appropriate nursing diagnoses for the patient that's anorexic. In planning nursing care, it's important to note that reintroduction of nutrients must proceed quickly, slowly, without caution, or I still have no clue, Professor D. Okay. And the correct answer is slowly. So this patient who has been in a state of starvation for a certain amount of time or chronically, as we're reintroducing foods, we have to do it slowly, because if we don't, there are potentially lethal things that can happen to the patient. We'll talk about it on the next slide. What complication can occur when nutrients are not reintroduced slowly? So these are the complications. What can occur? Can it be nausea? Can it be vomiting? Can it be diarrhea? Or can it be refeeding syndrome? What do you guys think? Very good. Refeeding syndrome. That is a complication that can occur, and we'll talk about what that looks like. Select all that applies. What are the potentially life-threatening symptoms of refeeding syndrome? Fluid balance abnormalities, abnormal glucose metabolism, hypokalemia, hyperkalemia, hypomagnesemia, hypophosphatemia. What do you guys think? Okay, guys, let's talk about it. Fluid balance abnormalities. And again, remember, this is something that's happening. This patient was in a chronic state of starvation. You cannot feed them too fast. Fluid balance abnormalities, abnormal glucose metabolism. Again, hypokalemia, hypomagnesemia, hypophosphatemia. And guys, pay attention. If you chose hypokalemia, why would you choose hyperkalemia as well? It's got to be one or the other, right? So these are the potential things that can happen with refeeding syndrome. True or false? An important intervention for the patient with anorexia is close monitoring of all trips to the bathroom after eating. Do you think that's true, or do you think that's false? True. When the patient's inpatient and they're anorexic and now they're in a controlled environment, the thought of gaining weight is terrifying to them. And so after, they're going to have to eat, but they're going to be worried about gaining weight. So they might try to go to the bathroom to have a bowel movement or to vomit. So they have to be watched very closely. And when they go to the bathroom, guess what? This one-on-one, you going, I'm going to. That's what it is. And this is part of their treatment, because we have to make sure that they're not purging, because at this point, they'll try to do anything to keep that weight off. True or false? It's important to observe the patient during meals to prevent hiding or throwing food away for at least an hour after eating. I spelled eating wrong. Is that true, or is that false? True. Very good. Everyone chose the correct answer. So sometimes what they'll do is they'll pocket the food. They'll just try to have it between their cheek and their gum, or they'll try to, hide it in the napkin. As soon as you're not looking, throw it away in the garbage. Anything from having to actually ingest the food. So they have to be monitored closely. True or false? The patient should be weighed daily during the first week of treatment. Then after this, he or she should be weighed 3 times a week. True or false? Okay, this is true. So when the patient just comes in for that first week, you're going to weigh them daily because we need to get this under control, and we're trying to get nutrients into this patient's body. We're trying to get that weight up to the normal weight. So the first week, this is something that's acute. We're going to weigh them every day. But remember, the foundation, the problem that's going on with this patient, it has to do with control. So what happens is, after that first week, and we've pretty much stabilized them, we're only going to weigh them 3 times a week, because what it's going to happen is that patient is going to be absolutely obsessed with the number on the scale, right? And then what they're going to try to do is, when it's time for them to be weighed, they're going to be like, wait, and they'll try to take off a barrette. Wait, and they'll try to take off socks. Wait, and they'll try to control the entire environment. And we don't want them to obsess over the number on the scale. We want them to focus on getting healthy. And so that's why we move from the acute phase of weighing them every single day to 3 times a week, because we don't want them obsessing over that number. Last question. A weight gain of blank per week is medically acceptable. So weight gain of 1 to 2 pounds per week, 2 to 3 pounds per week, 3 to 4 pounds per week, or 4 to 5 pounds per week. Which weight gain per week is medically acceptable? Oh, it's 2 to 3. Remember, this patient is severely underweight. They're severely malnourished. Okay. And so the name of the game is getting that patient to a safe weight. And so it's 2 to 3 pounds per week. Okay, guys, thank you so much for watching. Please, if you did not do so already, don't forget to like this video, subscribe to the channel if you haven't done so already, and press that red notification button so you'll be notified every time a new video is released. I am now providing NGN NCLEX review sessions, so go on my website and see what's available. Check it out, nexusnursinginstitute.com. And thank you so much for watching. You guys will catch me on the next video.